Welcome back, and let's have a look at the history of pandemics. My name is Dr. Singh, your emergency medicine specialist. We start off with the Antonine Plague from 165 to 180. It killed about 5 million people. Anyone who contracted it had a 25% chance of dying. It was at the time of the famous emperor Marcus Aurelius. The bug was thought to be smallpox. There's also suggestions it could be measles, but latest evidence suggests smallpox came much later on. Next, we have the Plague of Justinian, another Roman emperor in 541 to 542, with 30 to 50 million deaths occurring. Anyone who contracted this bug had a chance of dying somewhere between 30 to 90%. The bug that caused this is known as Yersinia pestis. It is the same bug that is thought to have caused the bubonic plague, but it's a predecessor. Next, we have the Japanese smallpox epidemic, which occurred in 735 to 737. And yes, as the name suggests, it was caused by our friend smallpox. It was brought over to the Japanese island from the Korean peninsula by a shipwrecked Japanese fisherman. It completely devastated the country with 1 million deaths, which is about 1/3 of the Japanese population. Next, we have the king of all pandemics, known as the Black Death, from 1347 to 1351. It is up until this date the most fatal pandemic recorded in human history, causing almost 40 to 60% of the population to be wiped out. The Black Death was also called the bubonic plague because it was caused by the bacterium Yersinia pestis, as mentioned before. This bacterium, Yersinia pestis, is a bacterium found in rodents and in their fleas, and this is how it spread across main Europe. There are other versions of the plague. The bubonic plague, which is the Black Death, was the most common form of the plague. It occurred because infected fleas bite a person or materials contaminated with the bug Yersinia pestis. Then they enter through a break in the person's skin. The patient then will develop swollen, tender lymph glands and fever, headache, chills, and weakness. The bubonic plague did not spread from person to person. It was transmission from the flea and the rats containing the bug. The other two versions of the plague are known as the pneumonic plague and the septicemic plague. The pneumonic plague is when Yersinia pestis infects the lungs. This type of plague can spread from person to person through the air. Septicemic plague is as its name suggests. The bacteria multiply within the bloodstream and spread to the different organs. It is a complication of the pneumonic or bubonic plague. This version does not spread from person to person. These infections are deadly. Antibiotics must be given within 24 hours.